Welcome. My name is Rob Bertolo, and I'm the president of the Canadian Nutrition Society. And I welcome you to CNS 2015. This is our opening event, and this is the fifth Food for Health workshop. So for those of you who are new to our society, the Canadian Nutrition Society was a result, it's a young organization, it's a result of the merger 6 years ago of the Canadian Society of Nutritional Sciences, made up mostly of academic researchers, and the Canadian Society of Clinical Nutrition, which was led by clinical practitioners. And so this merger brought together these groups, and we've evolved into a very vibrant society that looks at nutrition from basically the bench to the bedside. But since then, we have embraced relationships with government and industry as well as other professional societies, and this is to make sure that all the players in nutrition are at the same table. So in essence, we have been able to develop the society into a gathering place for nutrition experts in research, clinical practice, industry, as well as government. And this network is continuously developed so that all these sectors can come together and talk to each other about current issues, but also needs that have to be addressed in the future. And this workshop is an extension of this activity. So the Food for Health workshop has an overarching goal, and that is to improve the health of the population through food. And this workshop is the culmination of 3 previous CNS workshops, which were intended to gather information and address important issues facing nutritionists in all sectors. And in our 4th workshop last year, we brought together representatives from these 3 sectors to discuss public-private partnership opportunities. And this year is an extension of that workshop and moves from issues last year where we looked at knowledge generation or research, and this year where we're talking about knowledge translation or getting the message out. And Drs. Gramlich and Ma will talk about that shortly. I'd also like to take this opportunity to introduce the International Life Sciences Institute, North America, to this event. ILSI North America is a public, nonprofit scientific foundation that advances the understanding and application of science related to nutritional quality and safety of the food supply. Now, a key part of ILSI's mission is to, and I quote, provide a neutral forum for government, academic, and industry scientists to discuss and resolve scientific issues of common concern for the well-being of the general public. And so as you can see from their mission statement that our goals are one and the same. And so CNS is happy again to have ILSI as a continuing partner in this joint venture. And so with that, I'd like to introduce the co-chairs of this session, Drs. Leah Gramlich and David Ma.
We've already acknowledged the contribution of ILSI, but as a partner in this room today, taking one day off, spending it in Winnipeg, you are a partner in Food for Health. Everyone in this room has the opportunity to be an active agent for change, using the food supply system to enhance the health of not only Albertans, Canadians, but of the world, and we've got a great program lined up for you. It's nice to see frequent flyers in this room, people who come back, and there's nice to see some new faces. And we identified 4 key goals that were required to advance a food for health strategy to advance the health of Canadians. It's really important for us to advocate for the importance of food and nutrition for health. We do this by raising awareness with key decision makers, many of whom sit around tables here today. As catalysts for change, people in this room, we need to be working to influence, to inform, to generate the knowledge, and we want to impact and mitigate the burden of chronic disease. And we want to facilitate connectivity. So there's a lot of diverse stakeholders around the table. And in fact, as a group, we've been working to be solution-oriented. We actually want to come up with solutions to the problems, mechanisms, so that we're not just talking the talk, but we're walking the walk with our partners. I thought I'd put up these key messages from our first workshop where we actually had over 100 people at Guelph. We did a lot of brainstorming with those smarties, and there are several key features that came across. So although we came from diverse backgrounds, academia, the private sector, industry, government, we agreed on several features. We knew that there is a knowledge translation and transfer gap, and that at the end of the day, consumers aren't necessarily as aware as we think they are. Health professionals aren't aware as we think they need to be about the role of food in health. We recognize that there's a real piecemeal approach to food health initiatives, and that there needs to be a common goal established so we can advance on this. Despite the fact that we have multiple stakeholders and that they've got differing positions and priorities, we actually recognize that as an opportunity. We need to seek common ground so that we can align our efforts at the same time as maintaining our individuality. We recognize that the evidence for food for health needs to be scientifically grounded, evidence-based, using robust methodology, and that we have to be effective in translating that knowledge generation to synthesized tools and then implementing those tools in practice. So today we're going to see some of that work in action. I'm the doctor in the room. I'm always an outlier because I'm the health professional, and health professionals, frankly, don't have much grounding in food for health. We need to spearhead that because we've got a vibrant, organized nutrition science community. We need to move that into the healthcare community. And once again, we need to focus on practical solutions. Rob's identified the food for health topics that we've addressed. And I have to acknowledge our ethics group, who is really influential in informing our conflict of interest discussion policies that live on our website. Because anytime you bring together policymakers and researchers and product producers and retailers and distributors, there's a lot of crosstalk that can happen. Really big potential for conflict of interest, but in my mind there's no doubt that we cannot advance a food for health agenda without working collaboratively. So how do we do that? In this terrifying era of conflict of interest, when that word comes at you, we work to manage that conflict in an open, sharing environment because we think it's really important to advancing the food for health agenda, bringing multiple partners together. We, as Rob said, explored PPPs last year and are advancing that exploration today. At the end of the day, please do not walk out after the break. Think about these 4 questions. So we undertook some strategic planning yesterday, and our guide said, I'm going to give you homework the night before. So today at 3, we're going to have you go into breakout sessions. We use these food for health workshops to tap into your knowledge and skill and insights as leaders, as catalysts for change. So today I want you to think about barriers and enablers to making public-private partnerships go live. What are the perspectives, the private perspective, the public perspective? We want you to think about what opportunities are, whether you're from academia, government, NGOs, or industry. We want you to think about Match.com that we started to talk about last year. We're going to have a discussion on that. We want to get your feedback on what opportunities might exist. And then we want to see what you and your organization or Canadian Nutrition Society can play in advancing a food for health agenda. Think of the fact that 2/3 of people who are over the age of 60 in Canada have a chronic illness. The vast majority of chronic illness can be obviated by lifestyle interventions, diet and activity. We need to be part of that change. We need to be leading that change as a group that brings together researchers and practitioners. So objectives for today: how can we look at PPPs? How can they be effective in support of not only knowledge generation, but knowledge translation and knowledge exchange? What are these successful knowledge mobilization activities? How can we review these issues and come together as a group? Although we have unique interests, how can we come together to work together? And we want to strive for tangible outputs, but actually we see the people in this room as being a marker of success already. So thank you for joining us today. I'm going to hand off to David. He's going to explain to you some of the results from our survey that we undertook prior to this. David.
Good morning, everyone. It's a pleasure to be here again in beautiful Manitoba. Thank you. Well, Jim's not in the room, but I want to thank Jim for all his hard work in organizing the pre-conference workshop, the conference itself, and post-conference activities. And especially thank all our sponsors for their generous support of our activities. And one of our key signature activities for the annual conference has become the Food for Health workshop. And it's been a success, in part because of the, as Leah alluded, our high flyers who continue to return to our Food for Health workshop each and every year. And I think this topic continues to resonate with all the stakeholders in this room as we discuss issues, common issues that are relevant to our day-to-day activities. And through these open discussions, we're able to learn more from each other. And one of the things that we do as part of the Food for Health workshop is to conduct a little survey pre-workshop to gauge the sense of people's knowledge and to set the stage for our discussion and presentations. And I'm going to highlight for you a few of the results. So we had 75 respondents to our survey, and it was a good distribution of responses from academia, industry, NGO, and non-medical community, and the vast majority were our CNS members, and of 86%. And this is really great in that it represents our membership, a diverse membership from multiple sectors that really contributes to the vibrancy of our society and also of our various activities. So one of the first questions that we asked was, based on your experience, can you please describe your understanding of public-private partnerships? And our survey this year was less quantitative but more qualitative. So really trying to ask people for their insights and perspectives. And so just to highlight some of the key points that were raised in these responses, it was really informative in that it's telling us that there's still a lot of confusion around, maybe confusion is not quite the right word, but it still remains this black box entity, public-private partnerships, and the first response was no idea. So, but it also highlighted a couple of other key thoughts around trying to, how do we work together in this space of public-private partnerships continues to be a prevailing response. We also asked the question, what are priority areas or emerging issues in food for health that could contribute to improving the health of consumers and the public? So just asking a broad question around how can we work together to achieve common good? So there were really some great responses, and several responses related to around education being a really important area of focus, in addition to communication, so labeling, questions around food versus nutrient education around these various factors. And again, chronic disease such as obesity came up as well. And the question right after that was, would these areas issues benefit from public-private partnerships? And 92%, a resounding yes, said that while we still don't have a good handle on what is public-private partnerships, there is a general feeling that these partnerships can be very effective to address a lot of big problems. Did I go too far? Sorry. And in terms of trying to figure out how we can work together, we asked questions about what are potential barriers. And there were a lot of responses to this question around still, how do we work together? If we create ideas, how do we share in those, in contributing to those ideas? How do we work together in terms of matching timelines? So this kind of reminds me of Match.com, or just in general old-fashioned dating. How do we bring together people with different personalities, different perspectives onto the common page and grow something that will be helpful and productive. So we've seen some of these similar responses to this question last year. There remains barriers in terms of how we can connect together, how we can work together, how we can align our timelines together as well. We asked a similar question around, what are opportunities again? And similarly, we had responses around how do we educate, how do we support each other, how do we enhance funding opportunities, and some concrete examples were provided again. For example, the creation of a common resource where everyone is interested in it, but no one necessarily has the all the resources to undertake that leadership role. And again, conflict of interest came up in terms of being a area of opportunity to not necessarily a barrier, but an opportunity to resolve. This question is, in the past workshops, the question of who should communicate, transmit knowledge, outcomes has been discussed, who is best equipped. So again, looking around the room, we have multiple stakeholders and sectors from government and industry and researchers. And who among us is the best to communicate? So we asked, should it be researchers, should it be NGOs, should it be marketers and government? And resoundingly, a lot of people said, well, the marketers and advertisers and government have both resources and skills. But then when we looked at the responses, people said it should actually be the researchers who should be up at the mic. But the researchers themselves said, I should be the last person up in front of this mic. Maybe that includes me. And then another important point that was raised was the communicators, the person at the mic should be someone of a neutral kind of quality. And again, that speaks to, again, perceived or actual conflict of interest is still a prevailing concern. So this is an interesting dichotomy, the people that have the resources versus the people who should be the communicators. We asked the question around, what are qualities that you want in the people who are communicating? The top three that came up was credibility, expertise, and brand recognition were the most important virtues that people wanted to see in people who are communicating the information and knowledge. And then we asked the question around tools, and we'll have one of our speakers today will be talking about all the different tools that are emerging in the landscape before us. And we asked what are your perspectives on different tools, and in terms of social media, Facebook, LinkedIn, Twitter, these were the ones where people felt that there was strong utility. But one comment that really stuck out that we saw was that while these are important tools, it recognizes that everyone is a nutrition expert today. And that's because we have, Wi-Fi, we have smartphones, we have the internet, we have these very powerful tools. And so everyone is today potentially a nutrition expert, and we're competing against all 30 million other nutrition experts out there communicating different messages. So that was just a bit of a snippet in terms of the survey results. The full survey and all the results are going to be shared in the post-conference workshop report. But the intent today was just to give you a flavor and a sense of what are perspectives beyond this room and shaping the framework for our various presentations today.